Well, good afternoon. Welcome to the COVID-19 in Your Heart webinar with cardiologist Dr. John Katopodis, hosted by Tallahassee Memorial HealthCare. I'm Trish Higgins-Karowski, and I host the Eye on Health segments on WCTV's Eyewitness News at 6 on Thursday evenings. But today I'm going to be your moderator for the program. So if you have any questions, please use the chat function on your screen and get them to us, and we will do our very best to get the answers to you by the end of the program. Before we get started, though, let me take a moment to properly introduce our featured guest today, Dr. John Katopodis. Dr. Katopodis graduated from the University of Pennsylvania with degrees in biochemistry and philosophy, and then went to medical school at New York University. After receiving his MD, he completed his training in internal medicine and cardiology and has been practicing as an interventional cardiologist with Southern Medical Group at Tallahassee Memorial HealthCare since 1995. He's always loved sports, and when he's not at work, you'll probably find him on a ski slope somewhere or on a mountain bike trail. He's been a member of the American College of Cardiology Sports and Exercise section, and has been the cardiologist for the athletics department at Florida State University ever since he arrived in Tallahassee. Most recently, in conjunction with his partners at Southern Medical Group, he wrote the heart attack protocols for Tallahassee Memorial HealthCare on patients with COVID. And he and his group have been deeply involved in dealing with patients with COVID, both at Tallahassee Memorial HealthCare and Southern Medical Group. Welcome, Dr. Katopodis.
Thank you.
Just so that everybody knows kind of the direction we're going to take here, we're going to talk about the effects of COVID on both the healthy heart and people with heart issues. And then we're going to talk about what we can do to protect ourselves and what we can do in the face of this virus to protect ourselves. And we'll also talk about sports and exercise and how that all is affected by the virus and what we need to do if we are wanting to get back out there. So I would like to start off kind of broad, if that's okay with you.
Sure.
When this virus first surfaced, we started hearing so much about the lungs and how it just ravaged the lungs. People couldn't breathe, they were being put on ventilators, and that's what we thought this virus was all about. But then we started hearing a little more about how it affects the heart. And I wonder if you would talk about that. Let's start off talking about how COVID affects the heart.
Sure. That's a great question, because in the beginning, it really was all about the lungs. And we started getting news from overseas, and it was lungs and inflammation and things like that. And we were taken by surprise in many ways, because it turned out that COVID can affect the heart in just as severe fashion as it can the lungs. And what we've learned now is that COVID can have many effects on the heart, especially in severe infections. One thing that can happen is COVID can cause an inflammation of the heart muscle itself, where it can't squeeze normally. It just stops squeezing and stops supplying enough blood to the organs. And that can lead to a very low blood pressure, a condition called cardiogenic shock. So that's called myocarditis, inflammation of the heart muscle. Another thing it can do, and we saw this early in the epidemic, is it can cause an inflammation of the lining of the heart. It's called the pericardium. So imagine the heart here and a lining around it of tissue, like a sac. And if the tissue, the sac gets inflamed, fluid can build in that lining. And what could happen is the fluid compresses the heart so it can't fill with blood. And that can lead to shock. And we've seen that here. And
how common is it to see these effects on the heart with COVID?
You know, working in a hospital, of course, we see all the patients that come in from the region to our hospital. So we've seen these things. But in the big universe of the whole population of COVID patients, it's a very small number, but it can be really catastrophic when people have this. And then the third thing that can happen, and You've heard about blood clots forming in various organs. People can come in with massive heart attacks as well, where one or more of the arteries of the heart are completely blocked. So, and people can present with all three all at once. And in those folks, unfortunately, it can be catastrophic. But usually those people are very sick. They already have a lot of other things going on. Their lungs are already infected and stuff. But on occasion, we've seen some patients come in with just a mild fever and cardiac shock. And for all intents and purposes, it looked like a big heart attack coming in, and it turned out to be COVID. So
Really?
it's a spectrum. It's a spectrum. But, you know, we are talking about the extreme end of the sickest of the sick.
Did you see like a sudden rise in any specific cardiovascular conditions when this all started?
Well, actually, quite the opposite. And I don't know, there were some reports, and it actually hit the literature. There was it's the article, the title was, "Where Have All the Heart Attacks Gone?"
Really?
And it was kind of scary because there's a usual pattern of people coming in with heart attacks, and there's an average number of heart attacks that come in per month. And across the country, there was a reduction in the number of heart attacks that were coming in, and it's made a lot of people scratch their heads. And now we think what happened was people delayed care or did not seek care from fear of contracting COVID. And that's one of the indirect effects of COVID, that people stopped seeking care that they needed because they
were afraid to come into the hospital?
That's what we think. That's what we think. Because just because COVID happened doesn't mean that regular heart attacks aren't going to happen, right? So that's what we think is going on.
If you have you have existing heart disease, and you contract COVID, how does it affect the heart disease, and how does it affect the heart, and how I should react?
Well, that's a wonderful question, because the way to look at the heart is it's the engine, it's the pump that supplies nutrients and oxygen and things to the whole body. And when people become ill with the flu, a serious flu, or have a high fever, the metabolism, it goes up, and the body has a lot of demands. And sometimes the demands are so great, the heart needs to be pumping twice as much blood to supply the body with its needs. And so if somebody has a blocked artery, or has a previous heart attack, or has a valve condition, they might be feeling okay with the usual demands on the heart. But if they develop a serious infection where now they have to pump 2 and 3 times more blood, the heart doesn't supply enough to the body, and then people can have heart attacks from that. Even though COVID hasn't directly affected the heart, it's what's going on around the heart, and it can't keep up.
Let's talk about some more of these indirect effects. You talked about people not coming in to see the doctor having had a heart attack. Talk about how this whole thing it seems like we're not as active, we're not as healthy. I mean, 2020 was a tough year. I mean, 2020 should be a diagnosis in my book.
2020 syndrome.
Yeah, exactly. Let's talk about more of these indirect effects on the heart.
You know, they're pretty profound, and we see it every day, these indirects that you mentioned, because many people really remain hesitant to come and seek medical care because they're afraid to come into the hospital or to their doctor's office. But across the country, there's so many measures that are being put in place, measuring temperatures at the door, and mask wearing, cleaning surfaces, and so forth. I personally don't know of anyone who's contracted COVID by seeking medical care. I'm sure it's happened, and the risk isn't zero, but you're going to go to the grocery store, figure out a way to get your food. So right. Why should you treat your medical care in any different way? And I've had worrisome situations where people know, doctor, I don't want to do that. I don't want to have get COVID and stuff like that, and they're putting themselves at an increased risk. So that's a really big thing. And in the areas where the hospitals were overrun and the ICUs were full, well, there was still other patients that needed medical care, and there was a shortage of resources, and people didn't have access in some areas of the country to all of the things that they needed. People aren't filling their prescriptions. That's another thing.
Really?
They're afraid to go. Have you filled? No, I haven't done that. Why? Well, I don't want to go to the pharmacy. I don't have somebody. We heard a lot of that when we were doing more telemedicine. People aren't walking. They're not exercising. They're getting depressed or anxious, eating. So one of the big things that's happening, and we're not really going to know its full impact right now, we're going to learn it over the next few years, is people are becoming more sedentary. Their weight is going up, their blood pressure is going up, their diabetes, if they have it, is
People
less
are drinking more.
possibly, all
I
of
mean,
these
I've
things.
heard that.
So,
Yeah.
so there's this thing of the indirect deaths, or the unexpected increase in deaths. And you'll see coming out of the CDC and other places that there's a certain amount of people that pass away, seasonally. There's a certain baseline number. You add in the COVID deaths, well, there's an additional number of deaths that are happening that are unexplained. And they're probably from some of these indirect effects that we're talking about right now.
So if you have, heart issues, now more than ever, you should be going to your doctor, talking to your doctor, getting your medication, more so than ever before, is what I hear you saying.
You should continue doing what you should
You're
be doing
supposed
to
to be
take care of yourself, and be more vigilant about it, and realize not to have COVID control you. We have it in us to control what happens to us, and to control COVID is
Right.
the way I approach it with my patients, and including mask wearing and taking the medicine, seeking medical care, don't delay care. We've all taken care of patients who've come later in the course of their heart attack because they haven't wanted to come. And had they come a day or two earlier, or done something about their symptoms, they wouldn't have been as ill, when they presented.
What about stress? We all are talking about how we're under stress. This has been a really stressful year for everybody, or last year was. This year's going to be better. How does stress actually impact the heart?
Well, there's actually a condition. The medical name is called Takotsubo cardiomyopathy, big, long word. And
I
it's
won't remember it. Yeah.
there's a way to, and it was first identified in people who had a sudden severe emotional stress, like a loved one passing away, a car accident, something really distressing. And what happens is the heart muscle, from that adrenaline surge that happens, can become stunned. And we used to refer to it as broken heart syndrome, okay? And so in an extreme case, stress can cause a reduction in heart function just from a sudden severe stress. And that's not done by COVID specifically, but increased stress can has a domino effect, and people can then start doing some of these unhealthy things and reduce their health that way.
Okay. We have a question from one of our attendees. If I had the COVID virus and I am not having any cardiac symptoms, should I get a cardiac workup?
That's a great question, because we've heard about the effects of COVID on the heart. And there was an athlete who suddenly passed away in Europe after having had a COVID infection. And that's a really great question. We need to put it into perspective. Just as in the beginning, you asked me, what are the direct effects of the heart, and how many people are experience those? And in the big universe of people who've had COVID, it's just a small number. There's a lot of literature coming out now, and this has been my personal experience screening athletes at FSU after COVID infections, that in people who've had mild or moderate symptoms of COVID, it is really unusual to develop symptomatic, significant cardiac effects.
That's good to
And
know.
it's really, and it should be reassuring. But you see, this is the tough part for your viewers. And the tough part is, the flu is the flu, and this can be a bad flu, and it can wipe people out for a few weeks. They get sore and achy, their muscles are weak, they might have shortness of breath. People with the flu can have shortness of breath for weeks until the lungs recover. So the question is, what's hard, what isn't, and what should you do to go back to normal activity? And the response is, listen to your body. Just listen, don't push it. Don't go out and chop that tree down the day your fever goes away to prove that you've beaten COVID. Don't do that. Listen to your body. If you're feeling well, resume your activities slowly. And if everything is going well and you're not having problems like chest pain, shortness of breath, dizziness, weakness, then progress your activity level. But getting COVID doesn't equal go to the doctor to get your heart checked. That there's no indication to do that.
Okay, so really, if we are listening to our bodies, we know when something's seriously wrong, and that's when we would come to you and say, maybe I need a workup.
Sure.
Or you would say that.
Yeah, I mean, and more often than not, it's just going to be the usual residual respiratory effects or just weak muscles in general. Somebody who's had a febrile illness, a fever for 3, 4, 5 days, their metabolic needs are so high, they're going to lose a bunch of weight. They can lose 5 pounds of weight, 8 pounds of weight. And it's going to take a few weeks to recover from that. But it would be very unusual with a mild or moderate infection to have cardiac involvement. And your viewers may have heard this, that some people did MRIs routinely on people and found 60% of people with even mild COVID have this inflammation of the heart. And that came out of Germany. And then Ohio State University came out with numbers not quite nearly as high in their athletes, but they were still high. And then another study came out and it was a little lower. That's all still in the research world. And we don't know yet how to interpret some of those MRIs. And, people need to know practically, what am I going to do? What should I worry about? What should I not worry about? And if you're feeling fine and you haven't had a serious COVID infection, then follow the lead, listen to your body and take it from there.
Okay, let's talk about maybe some of those specific symptoms then, that if a person had heart damage from COVID, that they might be experiencing after a while, that you talked about specifically, like shortness of breath, the chest pain. Go through those if you would for me.
Well, sure. And you said shortness of breath, and realize these all overlap with all of the other things going on with COVID. And that's when you need to go to your doctor. You need to see your doctor and be checked out. If you're having shortness of breath, either at rest or with exertion or coughing or wheezing, you're not going to go about your normal activities. You need to go and see your doctor, because you don't know if it's your lungs or if it's your heart, and your doctor is going to figure that out with you. If you're developed chest pain, good chance it's just muscular pain from the muscles being sore from having had a viral infection and have nothing to do with the heart. And your doctor is going to be able to differentiate that. They may do an EKG looking for this inflammation of the lining of the heart and things like that.
You see, when you say chest pain, I immediately think heart attack. I'm having a heart attack if I'm having chest pain.
I use this analogy a lot in my practice. If you take a tennis ball and you put it in the right spot, right at the lower part of the breastbone, that tennis ball is going to touch heart, lining of the heart, pancreas, esophagus, part of the gallbladder system, lining of the lungs. There is a lot of stuff going on in that one little spot. So that's where, if you're having chest pains and you've had a COVID infection, that is something to consider going and seeing your doctor about. Heart flutters, you can feel if people are experiencing heart flutters, that's another thing. Generalized fatigue and weakness, that could be from anything, okay, right, including the
having
heart.
Kids.
There you go. So there's a lot of, so if you're not feeling right and you've had a COVID infection, you ought to be checked out.
Okay, swelling in the ankles, is that one?
Sure. Okay. But that, that won't happen in isolation usually. There'll be other things going on.
I made some notes, and the ones I was particularly struck by, not being able to lie flat without shortness of breath.
Sure. That's something we see in people with inadequate heart function and their lungs fill up with water and they can't breathe laying down. And that's pretty advanced. Those are pretty advanced symptoms. Somebody will should probably have gone to the doctor or the emergency room days before that happened.
Good point. But some people are avoiding that emergency room.
No, they are. We see very advanced presentations. Yeah, that's true.
Okay. Yeah. Lightheadedness, dizziness.
Sure. But that, a lot of those we call them constitutional symptoms, meaning it's like the whole body is involved. And there's this condition that can happen with COVID where the body loses its ability to regulate the blood pressure and pulse. And I've seen some patients like this, and that can last for weeks or longer. And there are reports now of this chronic condition that could develop in some people with COVID. And it would be dizziness standing, heart racing, weakness, maybe even fainting. Those are symptoms all that people really do need to be checked. But again, in the universe of patients who have COVID infections, this is a very, very tiny amount, because if you look at the hundreds and hundreds of people who've had COVID here in Leon County, we've only seen a handful of these.
Oh, that's good to know. Yeah. All right, I have another question here from one of the attendees. What is the general timeline that heart-related COVID-19 symptoms persist? And when should I be worried that I'm not returning to my normal, healthy, active self and need to pursue further evaluation from a cardiologist?
So that's a great question, and it's tough, and there's no normal for abnormal, I guess, in a way, because there's really no timeline that you can predict. And again, it's the same thing. Hey, I had this flu last week and I'm still feeling terrible. Okay, you haven't recovered. Right?
Right.
Go to the doctor.
Yeah. A lot of us who are, say, getting up there a little further in our years, who like to think, yes, we're growing up. Okay. But we like to think that we will still be able to bounce back like we did when we were younger. But when you get hit with something severe like this, I mean, it can really knock you out for a while.
It can last weeks. Severe flu infection can take weeks, because just as it can any flu infection, this doesn't go just with COVID. We saw this in the 2018 flu epidemic. Mm-hmm. And we saw a lot of people with a lot of residual effects. And there were about 65,000 deaths from the regular flu in 2018 in the US. Prior to that, it usually averaged 25 to 35,000. And you can see prolonged symptoms because it causes inflammation, weakness in all the muscles if it's going to hit muscles. And so not just necessarily the heart. And that can last a few weeks, just as the respiratory symptoms can last a few weeks. But the vast majority of people, and I've had patients all the way up into their 90s, just have very mild or no symptoms. And with the college students, yeah, I just lost my taste and smell for a few days, and that was it, or I just had a runny nose, and because they had a screening test that was positive, it turned out the runny nose was from COVID. Many people don't even know they've had COVID.
Right. Okay, I read something about that, and I want to bring and just kind of get your opinion on this. It was the Heart Association News, and they stated a growing number of studies suggest many COVID-19 survivors experience some type of heart damage, even if they didn't have underlying heart disease and weren't sick enough to be hospitalized. And I assume perhaps didn't even realize they had COVID.
Right.
What are your
And
thoughts?
that's comes from those MRI studies that I mentioned earlier. One of them coming from Germany, and the whole big deal was, well, how many people's hearts are affected, and we don't know it. Well, we've known for decades that viruses, especially cold viruses, can cause inflammation of the heart. And we've learned that all the way back from the Vietnam era, actually, because they were doing echocardiograms and other things in the military back then. And once in a while, we would see somebody come in out of the blue with florid myocarditis, this condition we were talking about earlier, inflammation of the heart and shock from a virus. Okay. So it's out there. This is something that we've known about. It's just that COVID has greatly raised our awareness. So in the end, it really boils down, it gets back to how sick were you with COVID and how are you feeling? Because we're not going to do echocardiograms on 1 million people who are feeling fine to find the one person who might have myocarditis at a particular moment in time. A lot of these people who have this type of issue actually don't feel well for a few weeks and then it goes away. And they never know that they even had it. So
we won't know about the long term, until the long term happens, a year or so from now, right? You're going to start seeing maybe.
Well, yeah, and that's what's starting to come out with some of this other stuff I was mentioning about the blood pressure and stuff, and these chronic COVID syndromes and stuff. And we're still learning. Every time I open an article, the first thing I do is look at what date it came out, because stuff that came out 3 months ago, a lot of it's just out of date.
Really?
And
wow.
You have to, and what we're saying today is probably going to change moving forward. And if you'll allow me, I think, for your viewers to get good sources of information, I personally think for the lay population, the CDC website remains an incredible website to just click into once every couple, 3 weeks, whatever, and read what they're saying. And then Anthony Fauci, frankly, will lay it out as it is. And he dealt with the AIDS epidemic way back in the 1980s. And with his actions, millions of lives were saved across the world. And those are the two sources that I would go to in people who want to stay up to date on this stuff. And then, of course, they're medical providers.
Right. We've got a couple of questions from folks who are watching, and we may have somewhat covered this, but I'll just let you give it a quick redo. How do I know if my heart has experienced inflammation?
So, like we said, the chest pain, shortness of breath, heart flutters, lack of ability to exercise or do daily activities as before, loss of function, so to speak. And a lot of those may overlap. They may overlap with other things like the lungs and other things that we talked about. And again, it's a matter of listening to one's body. And if it doesn't feel right, then go and seek help.
A lot of people with heart issues still participate in activities, exercise, athletics. What do you say to them if they've had COVID and they're concerned about getting back into it?
Well, again, it relates to what was the severity of the infection, and then what's the severity of the heart problem. Okay, so somebody who has a advanced heart disease, has had heart attacks, has a defibrillator, heart failure, they'll know if they'll take their own measure and say, I just can't do what I was able to do before. They need to be checked. If they've had a serious COVID infection, they would likely have gotten cardiac symptoms, right?
Right.
So it's the patients who've had mild COVID infections. And we're seeing patients all the time. Doctor, I had a COVID infection. It really wasn't that bad. It felt badly for a few days. And these patients might have had a couple of heart attacks and might have a pacemaker and stuff. And how do you feel now? Oh, I feel great. We're
Get
done.
back to it.
Yeah.
Okay.
We're done.
And parents know their kids. So if your child had a serious infection, yeah, it's safe to let them, and they've recovered, then they seem to be fine. Let them get back out there.
So, serious. So, what's serious in that instance? My experience with the younger population doing the screening at FSU, and this is what my colleagues are saying who do the same thing across the country, is the vast majority of young people have few symptoms, almost none or a few symptoms. A serious infection will land you in an emergency room or into a hospital, and that's a whole different can of worms. Okay. The NCAA did something out of an abundance of caution because we just didn't know COVID's effects on the heart and how widespread it was. And it mandated screening, echocardiogram, blood testing, EKG on all athletes, regardless of what the severity of their symptoms was when they had COVID. And it turns out that you actually end up reading a lot of normal EKGs, echocardiograms, and blood tests. I've yet to find one that has had an effect. And my colleagues
that's
across the
encouraging.
Right. So, and looking at the symptoms that are still being written down on their questionnaires and stuff, a lot of them are respiratory. And those students, we make them see their doctor. So if you have a COVID infection and you get over it, you feel fine, and it was a mild infection, and you're feeling fine, ease back into it. Don't go and run the marathon the next day, okay? Or don't drop the tree down or mountain bike.
Got it.
Okay, ease back into it. But if you're feeling fine, you're done.
Okay, let's start talking about what we can do to protect ourselves from it and to get better faster if we happen to have contracted COVID.
Well, I think this is so critical what you're asking, because it's like, all right, this hit us and we were reacting. And now what are we going to do that's proactive? Okay. How are we going to change where this battleship is going and head into a direction we want it to go to? Okay.
Right.
And one of the key piece of this is, one, it's mask wearing, whether or not you've been vaccinated. And it's incredible how important that is. And what I tell my patients is, your mask is your seatbelt. That's it. You don't go out on I-10 or even drive down the parking lot without wearing your seatbelt. If you don't wear your seatbelt, you're in a very, very small minority. And because even if we've been vaccinated, we have these other variants that are coming out. We don't know what they're going to do to our immunity. We're probably all going to have to get more shots as time goes on. COVID's here to stay. Dr. Fauci, I think just this week, said we're looking at mask wearing into 2022, I believe he said. Mm-hmm. And you don't want to tempt fate. You don't want to take that small chance that you're going to get COVID despite being vaccinated and not wear your mask. So do your social distancing, wear your mask, and then get out of your house in a safe way. Just get out. One of the tragedies of this epidemic, and we're still getting to understand the scope, is what's happened in our nursing homes. And, in their desperation to prevent the spread of this, many of these people were shuttered in their rooms. They were quarantined in the nursing home, and the nursing home was quarantined from the public. And they spent weeks and months in their rooms. And a lot of people ended up becoming much more frail. And we've seen weight loss just because they're not using their leg muscles. And they've gone from being able to walk to having to have a walker, or worse yet, having to be helped out of a chair. Well, that person can't withstand a heart attack as well, or another different kind of flu, or any kind of ailment, and they've been greatly weakened. So 40% of the death rate in the US has been in nursing homes. So that's an extreme example, but isolation, lack of activity can lead to increased frailty, worsening cardiac risk factors. So we need to just get out there. We need to exercise, and we don't have to be triathletes. The literature is so clear, just a moderate amount, 20, 30 minutes, 3 times a week is enough to improve cardiac function and reduce strokes and heart attacks and all these things. And so that's the other thing.
Go ahead. I'm sorry.
Yeah, it's okay.
Well, I was going to say fresh air, and don't we benefit from the sunlight, vitamin?
Well, sure. Yeah, vitamin D deficiency. Sure. You need sunlight to make vitamin D and make calcium and have good bones. So you asked me about indirect effects. I would not be surprised if 10, 15 years from now, somebody does a research trial and finds that there were more hip fractures in the 5 years after COVID. It sounds far off. It's plausible. It's plausible. And we're going to be learning about these indirect effects as time goes on. So what we need to do is wear masks, absolutely get vaccinated, absolutely get vaccinated.
Okay, I was going to ask you that because there's so much misinformation swirling around about that, what would you say? There are very intelligent people, friends, family members who are on the fence about this vaccine stuff. How do you talk to them about that? Should I or should I not vaccinate?
Sure. And, vaccines, and then you hear about bring in the no vaxxers, right? The people who say, oh, I'm not going to immunize my child. All right. And things like that. So this is the advice that I give. And virtually all the health professionals, this is the advice that they give. We have a vaccine that can reduce transmission, mortality. Well, no, it can reduce mortality. We don't know yet about transmission of the virus with the vaccines, but it can reduce serious infections, and it can reduce being infected in the first place. And we have to get vaccinated unless you have a severe allergy or something to the components and there's an absolute contraindication. We must do that because one, it's our own personal risk, because you don't know if you're going to get that horrible lotto ticket, okay, and you're looking at one of us in an ICU. You don't know that, okay? But it's the same struggle we have getting some folks to take a cholesterol medicine after a heart attack, okay? Some people just aren't going to do it. But the bottom line is there is no question that being vaccinated and staying current on the vaccines is of utmost importance.
Okay, so you have to wear your mask even after you've been vaccinated until we are, I guess, reaching herd immunity.
Yeah. And we don't know what's going to happen 5 years from now. We're going to be wearing masks a lot more, even after we've done this herd immunity thing. And look at what's going on in South Korea. They've been wearing masks for many, many years, and they have less flus apparently and things like that. But yes, we need to continue doing that. There's something we're in a really vulnerable spot. And if I have a second to talk about that, once we get vaccinated, okay, we can, our bodies can stop the usual COVID from happening. But when it tries to enter our body, it's still mutating. And it might mutate into a version that our immune system that's been vaccinated can't handle. And then you give that to somebody else. Well, guess what? You've just birthed a new strain of COVID.
Are we ever going to get out of this?
Well, I think we are. We're going to take control over it. but we really need to do the mask wearing, the social distancing, and the vaccines. We really need to do that, because COVID is going to go from being a pandemic where everybody's becoming infected to endemic, meaning it's part of our world, like the flu and colds and stuff like that, but in a world where we manage it and we prevent the complications.
So even if you have heart disease, the vaccine is right for you, basically.
Yes.
You need to do the vaccine. Oh, now they've come out, I think actually this morning they announced a third vaccine. Are there any thoughts on, for people with heart issues, which one is better? Or is it totally an individual decision between the doctor and patient?
Right now, the vaccines are all being rolled out, and frankly, whatever vaccine you can get to first, take it.
Okay.
That's what I've told my family, and I tell my patients, and we're really rolling out a lot more vaccines, and the governor expanded it to people down to 55, vulnerable people less than that, and it's coming out a lot. They can go to their primary care doctor, and they can TMH has a vaccination program. Pharmacies are doing it. Publix is doing it here locally.
And
now,
these are for people who are not just 65 and up.
Right. Who are more vulnerable. The governor just expanded it this week, yesterday, I think.
All right. Well, that's good to know. There are people who I've heard actually say, I had COVID, I have the antibodies, I don't need to get vaccinated. What do you say to them?
Get vaccinated.
Okay.
It's real
That's simple
simple
enough. Yeah.
It's real simple because, this is all based on hard science, and basically the science is really, really clear. You get both shots of the two vaccines that are widely available. You have a 95% chance of not getting COVID, serious or otherwise. And gosh, that is the best vaccine ever made. That beats the flu vaccine.
Yeah.
Okay. The flu vaccine, I think, is somewhere around 60% effective. And these are the best vaccines ever made. So the question is, why would you not?
Good point. Yeah. Okay. I have another question from our attendees. This is more specific, it sounds like. I'm 61 years old and I have a combo pacemaker and defibrillator device. Am I at higher risk if I contract COVID-19? And can I receive the vaccine now, even though we've answered this? Yes, you can get it, even though you're not 65.
Yeah, that's one of the vulnerable populations, because in this population, that patient's heart may not be able to function as well to deal with the stress of a high fever, to deal with the respiratory distress that might happen. And if the heart just can't supply enough blood to the body, then all sorts of terrible things can happen, and you can get a cascade that could turn into tragedy. That person today is at the front of the line to get vaccine and should be vaccinated. And we've, in our practice and with TMH, we're targeting all of those patients and getting the vaccines to them. And that's already been expanded as an indication.
Okay, we are coming pretty close to the end here. I'm wondering, do we have any other questions coming in from the audience? Yes, I do. I have one right here. If you had a heart attack 6 weeks ago and had 2 stents put in, should I be waiting to get the vaccine or wait while doing all of the safe distancing measures?
Get the vaccine. You see, they didn't sign into the webinar until maybe the last few minutes. Because the message is be vaccinated
and wear a mask
and wear your mask and get out. You take control of it and get your life back. Okay, and that's what I tell my patients: live your life, do it safely. All right. Get out and do your exercise, take your medicines, go to your doctor, take your precautions, wear the mask, get the vaccine, take care of yourself. Make yourself strong, okay? And if you are unlucky and you do get COVID, despite all of the above, you will be stronger. You will be able to deal with it better because you reduced your risk of something bad happening. And don't end up like some of these people who ended up isolated and more frail and stuff, because we know that being strong and doing exercise helps people live longer, live better, live happier. And there's no reason, even in the COVID world, that we shouldn't be able to continue to do those things. That's my advice.
I have another audience question that I'll get to in 1/2 a second, but first I want to ask you this: when, if we say I'm fine, but I have a 93-year-old mother who's isolated, if you can do it, get to your elderly friends, neighbors, family members, and get them outside. Am I hearing that from you?
Yeah, it depends on where she is, because the governor has very strict rules on people in assisted living facilities. And that's an extreme challenge in that age group. And you have to be careful. One, they should have been vaccinated by now. We have enough vaccines here in Leon County that they should have been vaccinated. So maintain your mask wearing, have her wear her mask, and of course, get her to be out and active. In my population of patients, the patients who are in their 90s, there's some universal characteristics. They're active. And I had one patient, oh, doctor, I exercise every day. What do you do? Well, for 10 minutes, I do this. This is literally his exercise. He's raising his hands over his shoulders, and he does something similar with his legs. And guess what? That is a very good cardiovascular workout. You don't need to be going outside in your sneakers running a marathon, and depending on your age. So I would encourage that. And then, of course, the emotional support and reducing the isolation. Those can be devastating if they're not there.
Right. Okay, let me get to that question from the audience. Do all patients with a heart condition develop severe COVID-19 symptoms?
No. I mean, it's a spectrum, and most people don't develop severe symptoms. Most people don't, but we all of us have the potential to. And that's why we wear a seatbelt.
Good point.
Right?
Yes. Yes.
Most people don't crash. Why do we wear a seatbelt?
Okay, well, unless we have any more audience questions, I think I'd like you to wrap it up with your thoughts, if you could, Dr. Katopodis.
Well, I think we're finally, we've gone from the point of fear of the unknown, not understanding what we're dealing with, being truly fearful, watching our lives going upside down, having massive impacts on family life, on our many people's work and everything. But now, we've learned a lot, and we're continuing to learn. And we're in a phase where it's not defense anymore. We learn who the enemy is. And this is going to a sports analogy. We know who our opponent is. We've seen the tapes. Okay. And now we have a strategy. And defense doesn't win, right? You've got to score points.
Right.
Right. And so it's offense, to get to that sports analogy. Wear your mask, that's offense. Go and get the vaccine, that's offense. Go and exercise. Go and make yourself as strong as you can. Go and study the CDC website. Listen to literally every word Fauci says. I do. Okay. And
he is my hero too. Yes.
And offense, that's how we're going to do it. And we're on the offensive. And the virus is trying to mutate now and change its strategies. We're going to beat it. It's going to take more vaccines, I think. And it's going to take ongoing vaccines. And we don't know what the outcome, what our society is going to look like in the with COVID becoming endemic, but we sure as heck know how to beat it.
You have given me great hope today. And I really appreciate it because, like I said, 2020, bad year. Don't want to go back there.
It was a bad year.
Yes,
and,
it was.
To your viewers, spread the word, kill some of that disinformation out there. You can, I guess the hospital is going to make a recording of this, spread it, and do your part to do that. And be careful what you read and so forth. You really need to go to good sites. But I think we're going to do well with this, and we already are beginning to.
Thank you so much. I'm glad to hear all of that. Wear a mask. Don't get sick. That's my takeaway.
There you go.
All right. Thank you so much for sharing your time with us today, Dr. Katopodis. I know you're a busy man, but we really appreciate your expertise in this area. Thank you.
You're very welcome. And thank you. This is very enjoyable for me. Thank you.
And thank you to all our viewers today. Thank you for the questions and the comments. If you would like more information about heart care at Tallahassee Memorial HealthCare, please visit tmh.org/heart. And if you'd like to learn more about the state of the pandemic here in Leon County, join our weekly webinar, which is called The State of COVID. And you can register to be a part of that at tmh.org/COVID talk. That's tmh.org/COVID talk. And that's a weekly webinar. And that's pretty much it for us here for Tallahassee Memorial HealthCare. I'm Trish Higgins-Karowski. Thank you so much for joining us. Take care. Stay safe.